This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right, guys. My name's Edmund Benedetti. I am the administrative chief resident over at Eastern Virginia Medical School in Norfolk, Virginia. Just so you all know, it is now known as the Eastern Virginia Medical School at Old Dominion University because there has recently been a merger with Old Dominion University here, which is pretty big news as of July of this year. Pretty excited, lots of good things coming from that. Everyone in the PM&R department is also, especially excited, and we'll talk a little bit about that in a couple of slides. So just made a, quick presentation, a little bit about our program, just so you guys get sort of oriented, and, just let me know if you have any questions along the way. Who we are, we have our department chair, Dr. Beverly Roberts Atwater, trained at JFK, actually under Dr. Cucurillo. She's our spasticity expert, and does a lot of stroke follow-up stuff in our outpatient clinic, lots of Botox. She also is on the inpatient side and doing a lot of our inpatient consult service as well. We have our program director, Mark Caramore, trained at the University of Virginia. And he's relatively new program director within the last 3 years. He's been a great addition to our program in terms of improving our inpatient rehab. He is the medical director of the inpatient rehab, that where we rotate for the most part, where we get most of our inpatient rehab experience. And we have our newly appointed associate program director, Dr. Natalie Montes Chinea. She did a training in Puerto Rico, and she actually did a neuromuscular fellowship at the University of Miami. So great training with her with our EMG department. I'm actually rotating with her right now on our outpatient side, just doing a lot of EMGs, getting those numbers up. And the leadership at our program is fantastic. I mean, they're really strong. They're really helpful with getting us to where we want to go. I feel, really close to them, where I basically shoot a text and talk with Dr. Caramore almost every day. Me and a couple other residents have a group chat with him because we like Lord of the Rings so much, and we chat about Lord of the Rings a lot. So it's a very friendly sort of collegial relationship that we have with our faculty, which is really nice. Just to talk a little bit about our class, like PGY2 class, we have Demille, was in the military. He's interested in pain medicine. We have Karen Luna, who was a physical therapist before all of this, and decided to go into medicine and do PM&R. And we have Fatma Segmen, who is from Turkey, is doing her PM&R residency with us. Does have an academic background. She's done a lot of research. So something that we're looking to bolster as well with this merger with ODU. In our PGY3 class, we don't have a picture for Dr. Jowdy there, but Dr. Jowdy came in sort of midway through. He's an addition to that PGY3 class. He came in off cycle from the Navy, from the Coast Guard, actually, not the Navy. But then we have Dr. Rosenthal, Kimberly Rosenthal, is interested in pediatrics. Dr. Chaplay, interested in pain medicine, and Dr. Thale, who is still undecided, but he is a DO. He's doing a lot of osteopathic medicine. He's doing actually lectures with us and for us, teaching us a lot of the osteopathic things, and practicing a lot of his the things that he learned in his DO program while in clinic and in the inpatient setting too, which is a great addition for our program. And then in the PGY4 class, we have Dr. Drake, who's our academic chief. he's sort of flip-flopping, deciding how he wants to go about his career, but he's very interested in sort of sports medicine and prosthetics and P&O kind of stuff. Kyle Stawitsky, another DO, has been helping a lot with the DO side of things and teaching us different techniques, and also just sort of educating us on the importance of different things that they've learned and things that they bring to the table and with their training. And he's going into sports medicine. He's applying just now. I think he finished his applications and he's going to sports. And then myself, I am going into pain medicine. Hopefully find out about the match in sometime in September. So where we are, we're in the Hampton Roads area, which is the southeast of Virginia. It is where Virginia Beach is, if people know that, a little more familiar with it. So our rotation sites are typically centered around Norfolk, Virginia Beach, and we technically do have a pain fellowship. It's up in Newport News, so that's why we included Newport News there. But a couple of nice photos. It's nice to be near the beach. It's actually lovely beach season right now. A couple of other photos here. This is of like the Norfolk area. Waterside is downtown Norfolk. This is kind of fascinating to me every single day. I'm from Miami, Florida, so we don't really have a big military presence there. But in Norfolk, it's the largest naval base in, I think, the world, or at least of the Western Hemisphere. So you get to see a lot of things you don't normally see. This battleship is just kind of hanging out right outside, basically some people's window. Just it's a museum, super cool if you're interested. Lots of history, lots of things to do. I mean, it's a smallish town, like medium, I'd say medium to small town, but enough to do where you have beach, you have outside stuff. Well, and I will talk about it a little bit later about all the things that we can do there. But really enjoy the area, and it's relatively close to a couple different fun places to visit. Um, about your training. So these are typical these are all the training sites that you go through. So Norfolk General Hospital is the main hospital that you'll be rotating at in our program. Virginia Beach General Hospital is another one where we have we do some part of our sports medicine outpatient rotation, and we have a inpatient rehab rotation there. Uh, Andrews Hall is an outpatient PM&R clinic. Sports medicine specialist, Intera sports medicine specialist, is a sports medicine rotation with Dr. Patel. It's a really nice rotation for MSK medicine, ultrasound medicine. Krishan pain specialist is one of the community rotations with a pain medicine physician and sort of outpatient PM&R in general. And we also have the Hampton VA. So a little bit more about Norfolk General Hospital. The main rotation, probably the most fun rotation that we have there definitely is our inpatient rehab rotation. It's a 16-bed general inpatient rehab unit. It's associated with the level 1 trauma hospital, which is SNGH. What we get there, a lot of stroke, a lot of trauma, decent amount of amputation as well, and a lot of medically complex, like cardiac patients. Norfolk General has a heart hospital that we are always seeing. I mean, we get to see a lot of like heart transplant patients, obviously, your heart failure patients, but in general, just a lot of stroke. We are technically in the area of the United States that's known as the stroke belt. So lots of people having strokes around here, unfortunately. But fortunately for your training, you do get to see a lot of it. And you do get to see a lot of really, really nice recovery stories, which is, one of the nice things about our field in PM&R. Get really nice quality of life and a nice connection with patients and seeing them kind of grow and recover from their injuries and their illnesses. Other rotations, you have the consult service where you will try to, you'll go around the hospital, obviously, and see if patients are candidates for the rehab service, but also, trying to manage their rehab care, even if they aren't candidates for rehab, the inpatient rehab there, regardless if they're going to like a lower level like SNF or even going home because they're too high level, et cetera. We have an ortho and trauma rotation. The trauma rotation serves more as like you're working as like a consultant, so it's kind of an extension of the consult service. The orthopedic service, you get to rotate with the orthopedic trauma team at Norfolk General. which is a great experience. Get to learn a lot about acute management of things if you need to, especially if you're interested in like the sports medicine side of things and musculoskeletal medicine. It's really helpful. And then if you're interested in more like pain, there are opportunities to for acute pain. There are opportunities to manage pain patients in the inpatient side who are suffering from acute pain and doing rib blocks, rib nerve blocks, and those kinds of things if y'all are interested. And then another strong rotation that I feel we do have is the neurology service. We rotate with our neurologists here who are incredibly intelligent, and they are really excited about teaching us, and they really like having us as physiatrists on their service. And we get to see a lot of really interesting cases at the hospital as well. Um, Move over to the next couple of sites. So I mentioned a little bit about Virginia Beach. It's a smaller rehab unit, 8-bed inpatient rehab unit, but it is ranked really well in the state of Virginia. It Dr. Quilter is the medical director there, and she's amazing. She's really smart. Gets you involved, lets you do a lot of different things for patients, and you learn a lot about sort of a little bit more of like the private practice side of rehab management, whereas the Norfolk General is a little bit more of like an academic setting. Um, Andrews Hall, like I mentioned earlier, it's our outpatient PM&R clinic. You're doing a lot of EMG, neuromuscular stuff, but there's also a lot of pain procedures. We have two C-arms, and a couple of our faculty do your epidural steroid injections, large joint injections under fluoroscopy. Like today, I just did a SI joint injection under fluoroscopy, and then also followed up by just a couple of knee injections and then EMGs in the morning. So it's a nice, very varied outpatient rotation. You get to see a lot of different things. You also see a lot of follow-up patients from the hospital, so that are discharged from our rehab unit. You get to see them, so a little bit of that longitudinal care. Sports medicine specialist with Dr. Patel. This is a great rotation for your interest in musculoskeletal medicine, and he's RMSK certified, so he's excellent teacher at the MSK side of things. Dr. Gershon and his community private practice does a lot of pain stuff, but a lot of EMG practice, and he's very good at setting you up for like the oral board kinds of things. He's the kind of person to give you cases like while you're trying to learn from him, and it's a really good opportunity to practice your thinking about things in front of you as they're happening. And then we have the Hampton VA, which is another outpatient PM&R clinic. In terms of our curriculum, like didactics, we're doing a hybrid Zoom and in-person lectures. They happen on Tuesdays and Thursdays typically. There's a combination of resident faculty and guests giving lectures. So like, for example, tomorrow we're doing a Zoom lecture. I know it's a Wednesday, but in general, it's only Tuesdays and Thursdays. But I'm giving a lecture at noon, a Zoom lecture about some TBI topics. We also go to the ODU School of Physical Therapy, which we were just there today, actually. They built a brand new facility there, really, state of the art. It's really, really fascinating, and they have a lot of resources there, which is great for us too in our learning. We do take part in cadaver labs for learning how to do procedures and ultrasound guided procedures. We'll have Dr. Patel come by and kind of show us how to correctly position things before we actually go and do it on live people, which is really helpful, I think. And also just getting reps in is really nice. We're also currently formalizing an optional ultrasound club. It's something that we're doing informally right now, where we're meeting weekly. And you can see here in the pictures to the right, couple of us residents there. I think I'm here. Yeah, I'm here laying down. And this is Dr. Drake Taylor doing a hip ultrasound because I was having some problems with my hip a little while ago. But it's fun. We follow. We start going through topics that we learned with Dr. Patel, and we kind of try to solidify them in this ultrasound club, and practice on each other and make sure that we're getting the right things that we need to see. And like with ultrasound, since it's operator dependent, it's good to get more reps in. We have a $350 yearly educational fund. I have asterisks on that just because I think that changes now that the ODU merger happened, and I don't have that information yet. But feel free to reach out if you do have questions, and I can find more official information on that. And we do have a QI and academic project required as part of your education here. Some extracurriculars that we've been involved in. Hope's Clinic is a volunteer clinic that we get involved in as residents that we help medical students with MSK exam. And it's a clinic set up to see underserved patients in the Hampton Roads community. It's really rewarding, and you get to see a wide variety of things from just really simple, like, I don't know, like patellofemoral pain to I saw somebody who we ended up diagnosing with metastatic prostate cancer because he had back pain and he was there for back pain. So you get to see a lot of different things there. Kaizen Athletics is another really cool opportunity. It's a volunteer at a facility for adaptive therapy and adaptive training, adaptive sports training. It's a really cool and very rewarding opportunity as well. Again, completely optional, all of these. Norfolk Public Schools, you can be a sideline physician. I was a sideline physician for Booker T. Washington School here when I was a PGY2, covering football games and basketball games, which was super fun. And other major sporting events, like there are marathons that happen here. Dr. Drake went to a surfing competition for like 3 days, which was pretty awesome. And then, you can be a part of QA committees as much as you want to be here. It's really nice. A lot of flexibility. Work-life balance. I think our program is incredibly nice with our work-life balance. Call schedule is 1 week at a time, home call Friday to Friday. Uh, and you can see here sort of the descending amounts of responsibilities for that. Um, I've only got 2 more weeks to go, which is fantastic. Um, Things to do in general. I mean, there's a lot of historical sites around here. We're really close to that historical triangle of Yorktown, Williamsburg, and Jamestown. 3 hours to DC. It's more about 3.5 hours because of traffic. I go up there all the time. I have an uncle that lives up there, and my girlfriend lives up there. Um, Lots of nature. Shenandoah is really close by. First Landing State Park is over here. So essentially, I mean, there's just a lot of things to do here. Obviously, the beach is here. The weather is nice. It doesn't get too cold. I'm from Miami, so I'm a little sensitive to that, I guess. But it really doesn't. It didn't snow. It hasn't snowed here since I've been here. But it'll drop down into the 30s, I think, in during the wintertime at the coldest. And these are a couple of photos of us just this year now. Where we go, so you have some information. Class of 20. We're kind of go everywhere. I think probably our biggest where most people have been going from our program has been pain. Um, You see, class of 2023, all three went into pain medicine fellowship. Last year, 2 out of the 3 did, and I think I'm the only one going in my class. And then there's only one other person in each of the other classes. But it's a pretty wide range. I would say pain is probably the most popular, followed by like general rehab and going into like a private practice. And then as of merger update, as of July 1, we became part of Old Dominion University. So what that means is we are now a public university. And that changed some stuff for like insurance, and we got a lot of nicer benefits, which is great. But we also have some really, really awesome opportunities to collaborate with Old Dominion University with their physical therapy and OT and kinesiology departments, as well as the engineering departments there. We had before the merger even happened, one of our residents that graduated went into pain, collaborated with the engineering school and developed an attachment to an ultrasound machine so that the needle, when you're doing like an ultrasound guided needle injection, the needle stays in plane all the time and you're not having to struggle with that. So it's something that, you know, is just going to be a lot easier to do if you're interested in coming up with research projects or like having resources to perform research. I think all that will be there for you all, especially in the coming years. Now that since the merger's happening now, it should kind of really settle in the next couple of years, which is just great news for everybody. Um, is there some contact information for everybody? Feel free to reach out whenever you want to myself or Dr. Drake. Adrian Lucas is our wonderful program coordinator who is super responsive and really helpful. And she's one that is also one I have on my phone numbers. I can text like at any time of the day, and she's always responsive and helpful. But that's pretty much it. Let me know if y'all have any questions, please. Sorry, I didn't realize I didn't have my camera on this whole time. Do I think there's a reason so many of the EVMS residents go into pain? I think we have Dr. Quigley Navarez. He's our pain program director at EVMS. Um, I would probably say that it's likely because we have a pain program at EVMS, or now ODU, and it's a little bit easier to just chat with somebody, and like our program director at Dr. Quigley with the EVMS department. Um, Easier to make connections with him just because he's there, and he's in an ACGME accredited program. Um, and I know that in the past, Dr. Quigley was more in the Norfolk campus, but now their campus has moved, and they moved over to a practice up in Newport News, which is about like 40-ish minutes away driving. So that influence isn't as like heavy, I would say. And I think you're seeing that in some of like the distributions in the last few classes, where it's just like one or two maybe out of the three, as opposed to a little bit more consistent, like 2 to 3 people interested in pain, because they would rotate a lot with Dr. Quigley. So I think it's just a product of, what you're exposed to, and what you kind of get uh opportunities to perform. Um, I would say that, yeah. Let me know if that answers your question.
Thanks, Dr. Benedetti. We really appreciate your time.